All right, it's exactly 2 o'clock Eastern. I'll leave the poll open for a few more minutes while I do the introductions. I appreciate you all taking the time to answer. We are very honored today to have Ms. Katrina Brisbane, the Deputy Assistant Secretary of Acquisitions with the Health and Human Services, with us as our speaker. My name is Reena Bhatia. I am your host. I am the CEO of Proposal Helper and Bid Execs, but in my role today, I am coming to you as the GovCon Chair Committee, GovCon Committee Chair for the Asian American Chamber of Commerce. We are an all-volunteer board that works with the Chamber to help companies in the Virginia, DC, Maryland, and actually now across the United States with their not just business, government business development, but government and commercial business development. We host networking events and have other great benefits. We hope that you will consider joining the Chamber. It is through the Chamber and through all volunteer board members that we bring webinars like these to all of you. And our intent is to allow you to ask questions, get the information you want in order to help you improve and grow your business with the various agency speakers that we bring in. Quick note, while I have this screen up for you, today's webinar is being recorded. We will provide the recording and slides to all the participants. And we ask that if you have any questions for our speaker, please submit it in the Q&A box. The chat box is for all of you to network with each other. With that, I'm going to end the poll for now and switch over and hand the microphone over to Becky Morris, who is our moderator for today. Becky, over to you.
Thank you, Reena, and welcome everyone to our webinar today. My name is Becky Morris. I'm a managing partner at Bid Execs. I've got a background in the private sector initially, doing planning and development for capital project delivery, but now switching over to the Bid Exec side to help people like yourselves trying to find business development opportunities and proposal writing services. So I'm very pleased to present a little bit about Ms. Katrina Brisbane. Before we turn it over to her, she's got a very impressive background and we will be learning a lot from her today. So a little bit about Ms. Brisbane. She is currently the Deputy Assistant Secretary for Acquisitions and Senior Procurement Executive for the Department of Health and Human Services. In her role, she advises the senior executive leadership on matters related to health and human services acquisition enterprise while ensuring the delivery of the best value solutions across the 40 billion acquisition portfolio. Prior to this role, she served as the Assistant Administrator for the Office of Contracting and Procurement and the Head of Contracting Activity at the Transportation Security Administration. In that role, she was responsible for oversight of contract operations, contract policy, business systems, and strategic planning of their acquisition portfolio. She has also served as the executive liaison to the U.S. Department of Homeland Security, Chief of Procurement on all matters related to the TSA contracts and procurement, policy legislation, as well as the workforce. And then prior to that, she also served as deputy head of the contracting activity for the Defense Information System Agency. She also provided oversight and strategic planning for the acquisition of telecommunication systems, information technology assets, and the associated services with that. So quite a great bit of experience. And her educational experience is just as impressive. She's got a master's of business administration, a master's of science and human relations, and a bachelor's degree in computer science and business administration. So quite a lot of experience and education there that we can learn a lot from today. So Katrina, I will turn it over to you to introduce yourself a little bit more if I missed anything there.
All right, thank you, Rebecca. Good afternoon, everyone. I'm excited to talk to you about HHS. So much going on across the enterprise. I myself have been at HHS about 2 years and have been absolutely impressed with the work that goes on at HHS as a part of securing the health and well-being of the American public. You can go on to my first slide there. So I am very excited to talk to you about the mission, some of the things that we're doing. I'm going to kind of go through today to cover that and some specifics and some of the spend breakdowns across the enterprise. HHS has 11 operating divisions, many of which you've heard of, and 14 staff divisions. So I'm going to talk about where our spend is driven. Talk a little bit about a few challenges, some you already know about, and some of the initiatives that are ongoing across HHS, some upcoming procurements, some of our industry engagement, and then how do you engage with us? So hopefully your takeaways today will be such that you will have multiple opportunities with HHS and be able to find where those opportunities lie and be able to engage with the staff at HHS to understand where are pain points and what are the things that we're looking for in our partnering community and industry. We can go on to the next slide. So first thing, as I mentioned earlier, big mission at HHS is to enhance the health and well-being of all Americans. There are 14 staff divisions and 11 operating divisions. And so for those of you that do, I always break this down. For those of you that do work in the defense community, that breaks down to our MILDEPs and our ODAs, so other defense agencies and military departments. So our military departments are our frontline agencies, those that you've heard about, National Institutes of Health, FDA, CDC, CMS, just to name a couple. There are 11 of them. I won't go through. You can check out our website and you'll see all of them. And then we have 14 staff divisions that are connected to the Office of the Secretary. And those staff divisions also have big missions across HHS. And they range from our Assistant Secretary for Preparedness and Response. So first of all, they actually will be an operating division soon. So we're just waiting for the process to take place on them. But we've got the National Coordinator for the Health Information Technology, our Global Affairs that fosters critical global relationships. And I think that we can all agree that we've seen where that is very, very critical, especially for critical products for the American public. Then others of our operating divisions, Head Start programs at ACF, the Unaccompanied Children's Program, of which you've likely seen and heard of the surges that have occurred in that mission area over the last year and a half or so. We've got our health research out at NIH. We've got much of the posturing and service delivery for Medicaid, Medicare out at CMS. So a lot of mission space to enhance the health and well-being of all Americans. For such a short mission statement, it is vast across HHS what we're doing that touches every American from birth all the way to expiration. And so I'm sure that if we got into more discussion on that, I'm sure that each of you will find that there's something that HHS does that touches your everyday life. So such a vast mission and one honorable mission to become involved with. Right, we can move on to the next slide. So one of the things that I do like to do is encourage our industry partners to really stay in tune with the strategic plan of any agency that or department that you are interested in working with. That strategic plan typically lets you know where the agency is focused, what are their priorities, so that you can align your business strategies, your lines of business, and make determinations as to whether or not the work that you do actually can contribute greatly to the mission and the initiatives to which that agency is trying to accomplish. So HHS has taken a different approach to publishing their strategic plan. They've decided it is going to be a web document. And that way, it can be a living document that can be updated as our priorities shift. I'm sure that each of us can agree that over the last 2 years, we have had to pivot when it comes to the health and well-being of the American public. We'll talk a little bit more about some of those challenges in just shortly, but I'm sure that you can appreciate why it's very important for HHS to approach its strategic plan as a living document for its management to ensure that whenever things change, and has been, and we're seeing that now, that it is changing often as to where we need to pivot and focus our attention. But I would encourage each of you to take a look at our strategic plan. Those strategic goals, you click on them and they've got additional aspects of them for you to actually dig into and understand where HHS is going and what directions we're headed in. I would say also all of the agencies, some of which I've just mentioned, they will also have subordinate strategic plans to the department, but they'll have their focus areas. What is it that they're focused on? And so you'll get an opportunity to see exactly how you can become a part of their respective missions as well. We can go on to the next slide. So this particular slide gives you a general idea of where that $40 billion or so actually breaks down to. So prior to COVID, HHS actually spent about anywhere in the mid to late 20 billion, 25 to 28 billion or so prior to COVID. Still ranking amongst the top 5 of spend in contracting across the federal government. Since COVID, HHS has been kind of steady in the second place over the last 2 years. We'll see where we come in at the end of September after the close of the fiscal year. But we have been trending in the second place. Why? Because of the vast response efforts going on across HHS for COVID. Additionally, we've had a few other areas of priority that have happened, and we'll talk about those shortly. But this slide is designed to give you a little idea of what our spends look like across HHS in the respective operating divisions. Those are our frontline divisions that are actually touching the American public on a day-to-day basis. This gives you an idea of not only how much they've spent, but the top 3 areas in which their dollars go. So hopefully that'll help you to target some of the aspects of what's going on. And it tells you a little bit about the focus of the agency as well, where their dollars are targeted. All right, we can move on to the next slide. So this provides you a little comparison of the spend. You may see a few numbers that may be just a little off from what you've seen on the previous slide with regards to FY21 numbers. And some of those come as a result of de-obligations that may have occurred over the last year. We closed at the numbers in the previous slide. However, sometimes de-obligations occur across the enterprise for various reasons. Sometimes they're shifted to other contracts. Sometimes the dollars that was anticipated to be spent on a specific response effort may not have been spent to its fullest degree. And as a result of that, there may be some de-obligations that occur and a varying of other types of reasons. But this still gives you a general idea of the contract spend comparison to where we currently are in this fiscal year. So one of the things that I'm sure you can see is that CDC is leading the pack. And CDC, even in August, as of August 11th, had already surpassed where their spend was last year. Next is the Indian Health Service. A lot of activity going on there as well. Very, very close to where their spend was on last year. The rest of them are bringing it in. This is the time of year we do the most of our work. And I truly expect that by the end of September, these other offices will be very closely trending, if not exceeding, where they were on last year. Typically, our largest spending agencies are CDC, NIH, and CMS. Okay. Thank you. Please go on to the next slide. This slide is designed to give you a general idea of what we're spending in the 10 areas or taxonomy areas, the various industry and lines of business. You see, again, this helps you to see where the agency is targeted, quite a bit of medical and services that are ongoing across HHS, quite a bit of professional services, as you can imagine, where an agency is doing a lot of medical services. There are a vast amount of analytical type of services that are also ongoing across the enterprise to support those medical services. So as you can see, HHS is spending its dollars to actually bolster its mission in a very, very big way. But overall, regardless of what your line of business might be, this gives you a good picture of where HHS is focusing its dollars and areas that you might consider. It gives you an indication of areas where you may want to consider your business development efforts to approach HHS and its opportunities. Okay, we can move on to the next slide. This is a snapshot to just kind of give you a little bit of our small business spend. Last year, HHS spent a little over $9 billion total in small business awards. HHS is now trending at about a little over 5 million. We're close to, we're working very hard to get to the goals that have been prescribed to us by the Small Business Administration. We're still hopeful. What we find is that in the last half of August and all of September is when we spend the most. And so as a result of that, we're anticipating that we'll be sliding into home base on September 30th. But this is the time of year we spend the most. One of the hampering elements that we find is when there is a later budget in the year, we spend later. And a lot of that has to do with the availability of funds. And so this year, it was approximately April, I believe, is when the president's budget was passed. And so we were able to all get budgets. And at that time is when the spending actually begins on the requirements across the agency. We're able to put in place new contracts. And then at that point, we're able to fully fund those contracts that we may have been incrementally funding under a continuing resolution. And so we expect to slide into home base by September 30th, but this gives you just a snapshot of where we are in our small business achievement for FY22 and where we ended up on last year. All right, we can move on to the next slide. All right, so back to the mission. We talked a little bit about in the beginning about HHS and its mission and how vast it is and the multiple operating divisions and staff divisions and their work that they're doing to enhance the health and well-being of the American public. There are a couple key mission challenges that I'm sure each of you've heard about, either in the media and the news. That this is COVID-19, which is now have been around about 2.5 years. Our Assistant Secretary or Administration for Preparedness and Response is our key agency that is focused on COVID-19. There's been quite a bit of initiatives that are going on. I'm going to talk about their industrial base expansion initiative here shortly. But even in the testing aspects and the vaccine aspects, this agency has been very busy at work ensuring that the HHS response to COVID is ensuring that the American public is protected. One of the things that I like to talk about on the COVID-19 area is back early in the year, one of the things that was very, very much a challenge was that it was hard to get in and get a test. I remember back in January coming off of a trip and needing to get a test. And one of the programs that we call them ASPR, one of the programs that they initiated is a expansion of testing in various communities, especially rural communities and underserved communities, smaller towns. It was very difficult to get a test, and a lot of that had to do with just the volume of those that needed tests. And it was difficult really to get an appointment to get a test. So if you thought you had COVID, you might have had to wait 2 weeks. Well, this group executed an ICAT, what's called expansion of testing initiative. And immediately across the country, we were able to experience the availability of testing in all communities. And so I do know personally that this team worked through the holidays, through the Christmas holidays and into January to make sure that the testing was available for the American public. So a lot of hard work going on in these programs. Our unaccompanied children's program, surge operations at our southwest border, the Administration for Children and Families, another one of the key challenges for HHS across in its mission. And so this is something that is still ongoing. This organization is working on building an industrial base. I will talk to you a little bit about that shortly. And then monkeypox, just recently on the scene. We've got that, again, the Administration for Preparedness and Response on the point with ensuring that we are able to provide a response for monkeypox, and the Center for Disease Control, or CDC, also working in partnership across the department to ensure that HHS's response there, it covers down and provides a safety net for the American public. Right, we can move on to the next slide. So to talk a little bit about a few other initiatives across the agency, one of the critical products categories that we did find during the COVID-19 pandemic, and it continues to be a little of a challenge, is that we did not have critical products such as PPE, or personal protective equipment, available for the American public at the volumes that were needed. And so just recently, November 2021, the Infrastructure Investment and Jobs Act was enacted. And this particular legislation speaks to infrastructure, but it also speaks to domestic manufacturing, and it levies some requirements on HHS for personal protective equipment. So it's what I call sometimes it's a kitchen sink type of legislation. It has a lot for multiple agencies, but on the HHS end, one of the major focuses here is for HHS is and I just say one of the major focuses, there are multiple, but one of the major focuses that I'd like to talk to you about today is the domestic manufacturing of critical products that we call personal protective equipment. So this particular piece of legislation levies on HHS the requirement to only purchase PPE, as we call it, that is domestically manufactured, that is grown, processed, reprocessed, and produced in the US. As well, any contracts that we put in place for PPE must be at least 2 years in its period of performance. And so this is something, an initiative that HHS is working on with regards to PPE. Again, when we get to the industrial-based discussion, we'll talk a little bit more about what our ASPR agency is doing with regards to those initiatives. But overall, just wanted you to know a little bit about this. We just held a recent industry day to discuss some of the work that we're doing, and we still have other initiatives and other strategies that we are working for the enterprise of HHS so that we can make sure we are aligned well when purchasing PPE across the enterprise. The domestic manufacturing of all the PPE listed in the Act is indeed a challenge. We look to our industry partners to assist us with this. We have launched some initiatives to expand manufacturing in the US, but we are still a little ways before we will see how that, the impact of that and the volume that that produces for us across the enterprise. So please know what this particular legislation is. When HHS is going to purchase any personal protective equipment, our requirements will align with this legislation, and we're looking to find those pieces of PPE that aligned with the reprocess, reuse, or produce all of its materials and components are grown in the United States. Very, very important to know. Now, one of the other things that I would say is that there are, and if we can go on to the next slide, there are other measures if we're unable to locate manufacturing in the US of the PPE. There's the Made in America executive order, which has become a part of the previous legislation, the IIJA that I just mentioned. But Made in America also was an early initiative of the current administration to expand manufacturing and increase reliance on domestic supply chains. Very important. It also provides for specifics when we're unable to locate domestic manufacturing or processing and products grown in the US for certain types of goods. So this Made in America actually expands beyond PPE, but it does include PPE, and it allows us to have what we call a process to request a non-availability waiver when we are unable to locate domestic manufacturing or products being made and used in those particular end products for the requirements across HHS. And I spent a minute on this and talked about it because I'm getting quite a bit of questions from our industry partners on Made in America and IIJA and their particular product lines that may not be manufactured in the US. And so wanted to help you understand a little bit about what HHS must align to in its requirements for PPE. And then for other than PPE, we are required to try to increase our reliance on domestic supply chains. And if in fact we're unable and we exhaust all efforts, then there is a process that we can engage to obtain a waiver. But most importantly, it is highly emphasized that we increase reliance across the enterprise on the domestic supply chains, and that is across government. Okay, we can move on to the next slide. So I've made reference to this a couple times about our ASPR organization and some of their initiatives in the industrial base expansion area. And so several of the areas that they are actually focused on is vaccine production and administration. And we're grateful for that. I think all of us may be grateful for that. Advanced manufacturing and supply chain optimization. One of the things that they have done is they have provided and facilitated investments in multiple companies across the US for manufacturing of the pieces and parts that we are needing, both in pharmaceuticals as well as in PPE. what we anticipate that will happen out of that is that we will have an expansion of production and capabilities across the U.S. for critical product needs for the American public. It is anticipated that once the investments have permeated, that these investments will produce a manufacturing capability for critical products across the US. And then from there, once the government's investment has facilitated such a volume of production, we anticipate commercialization, especially in areas such as vaccines. These are the vaccines that are newer on the scene, such as the COVID-19 vaccine. So we expect the commercialization of it and the production of it by commercial industry. After the government has facilitated the ability to expand these capabilities across across the US. All right, we can go on to the next slide. One of the things I did forget to mention on the previous slide, and I had made implication or reference to it earlier, is that industrial base expansion is very, very critical to HHS to ensure that, one, we are able to have industry partners that will help us to meet our mission, not only in the critical products area, that we do want to make sure that the supply is available domestically for all Americans, but we also need to ensure that we've got appropriate partners to help us meet some specific missions across HHS. In the unaccompanied children space, one of the areas that is very important is what we call wraparound services. And so wraparound services provides the basis for the unaccompanied children's program and how they support these unaccompanied minors. So wraparound services is designed to support programs and provide shelter and childcare, education, medical assistance, clothing, legal assistance, food services, and a host of other care to unaccompanied children and minors in the custody of the Administration for Children and Families. Very important, this particular initiative surged off on last year. And one of the areas that we have found is that we do not have a large industrial base to support this initiative. So you are going to be hearing about, and please check out the Administration for Children and Families website. They will be having an industry day, planning it in October. So they're in the midst of planning that right now, so that they're able to connect with industry, let them know what the needs are for their respective programs, and facilitate the interest in that mission to provide services that are needed for that unaccompanied children's mission. But there is definite need to expand an industrial base, to expand services and ensure that there's an appropriate industrial base to support this program. Again, look forward to the Industry Day that's coming up in November to talk more about that program. Right, so this slide actually tells you a little bit. I'm going to go back to what I was talking about before. In our Administration for Preparedness and Response, I told you about the investments that were made to ensure we can expand manufacturing and production on both the end product as well as the pieces and parts to establish sub-tier manufacturing for those critical products. And so this gives you a list of those thus far that the government has invested, or ASPR has invested in, to do one of the things that I just mentioned. But all for the goal of expanding manufacturing and production domestically for availability of critical products for the American public. All right. We can go on to the next slide. So this is a new program, a new agency that I am very, very excited to tell you about. So just a few months ago, the president actually directed the stand-up of an Advanced Research Projects Agency for Health, better known as RPAH. RPAH is designed to and commissioned to drive medical breakthroughs in transforming health solutions that can improve the health of all Americans. We are excited about advancing this capabilities in health research at HHS. Along with this RPAH new agency, and it will be housed under the National Institutes of Health. This new agency will also have its own contracting office, and you'll hear more about industry days in coming months for this office as well. They're going to be designed to bring innovative solutions and to support this particular mission area, driving biomedical breakthroughs and transformative health solutions to improve the health of Americans. So this is a very exciting time. We are very excited to stand up this new agency. And as an acquisition professional, I am very excited to support and help stand up this new contracting office. So you'll hear more and more about RPAH as the months go along. But please note this particular agency has been given the authority to award contracts and grants, enter into cooperative agreements and other transactions. I anticipate in the early months, you'll see more about contracts and other transaction agreements for this particular agency. But it's an exciting time. It's a brand new capability to bring more health solutions to the American public, and RPAH standing up, and they've been moving at lightning speed to become operational. And so you will hear more and more about RPAH, I'm sure, in the media, but please stay on the lookout for their industry days and their requirements that they will publish. Right, we can go on to the next slide. All right, a few other initiatives that we have across HHS. I talked a little bit about IIJA, so I did get a little ahead of myself there, but we are targeting large areas of spend. As many of you know, category management is a major priority and has continued to be even under this administration. And so what HHS is doing is taking a look at where are we spending our dollars and how do we buy as an enterprise vice 11 individual contracting offices. And so we're working on that. And as you could imagine, with anything that is as large of an entity as HHS is, it will take some time. But we are headed in the right direction for this, and we are beginning to pivot into how we purchase as a large entity. And one of the areas that we are pivoting on is taking a look at how do we buy PPE across the enterprise. Vice buying it in individual entities, we're looking at enterprise contracts for those PPE that are outlined in the Infrastructure Investment and Jobs Act is one initiative. Other initiatives that are on the horizon is pivoting our IT spend and our medical spend to targeting certain vehicles. So those are very, very important. So I would say to those of you who are on GWACs, government-wide acquisition contracts, very important in this time because category management is here to stay and it is a major priority. So very important that we are buying as an enterprise, as a government. And that is the purpose behind applying category management principles to how we buy as an entity. Just as a side note, one of the things that are important, we just recently held an industry day that we discussed the nitrile gloves, some of the requirements for HHS and nitrile gloves. As you can imagine, we use nitrile gloves in a major volume. Additionally, the Strategic National Stockpile that is under the Administration for Preparedness and Response supplies the states. You can imagine the volumes that are required for gloves for the Strategic National Stockpile, as well as NIH. And so we just held an industry day a few weeks ago to discuss the requirements there, but you'll see more about those enterprise type vehicles coming out of HHS. Next slide, please. These are just a few requirements from a couple of our agencies that you will see coming out soon. And I'm going to tell you in just a moment how you will see them. What I would say to you is take a look at forecasts. And as I mentioned, one of the major strategies that is being applied by HHS is category management. So oftentimes where we can find that there's already a government-wide acquisition contract available for certain types of commodities and lines of business, that is where we will pivot to make those procurement buys. But these are just some upcoming procurements. If you check out our small business customer experience, which I'll talk to you about just shortly, you'll be able to see more details on these. All right, if we can go to the next slide. All right, so this is about our industry engagement. So I've given you a little bit of information about HHS, our mission, what are the things we're working on, some of the initiatives and the passion and heartbeat of the agency right now, some of the challenges and things where we are actually trying to expand an industrial base, which is where we need your help. But want to talk to you a little bit about the various aspects of engagement. So first of all, you heard me mention small business customer experience, a tool that is very, very important for us as well as our industry partners. It is our official forecasting system for procurement requirements or contracting requirements for HHS. Just recently, we had a memo signed out by the Deputy Secretary that required that all HHS procurements and contract opportunities are posted in the small business customer experience. The small business specialist, it must be done before that the small business review is done. Additionally, what is anticipated is that by the last Friday in August of each year, the small business customer experience should be populated with the agency's forecast for the next fiscal year. Now, as I mentioned earlier, HHS is a large entity. And so as we move into this direction, I completely expect that it may take some time to realize the benefits of this change, but I'm actually very excited and expect that this will be a game changer so that we can let industry know, you as our partners know much more readily where are our opportunities and how you can get involved with them. And so I've got down there SBX and where you can locate the SBX system and be able to check out opportunities. SBCX also has a market research component by which you will be able to drop in your capability statements. And guess what? One of the things that contracting officers and contract specialists, as well as our contracting officer representatives and project managers do as they are looking for companies with capabilities, they're able to search our market research portal in SBCX to take a look at capability statements and understand if there are companies in the market to do the specific work that they're writing requirements for. So a very good tool to drop off your capability statement in and to make yourself available and show your capabilities to the HHS community. We take a look at the top small box there, looking at Aussie Boot training opportunities. Earlier this year, the Office of Small and Disadvantaged Business Utilization held their annual training conference. They typically do so in May or June of every year. Has a wealth of information, partners from all across government to participate and provide information. The meeting topics range from engaging with HHS to discussing with HCAs and program managers, matchmaking events, topics on category management, topics on how to build capital or how to obtain capital for expansions in your business, and a variety of other topics. We bring in subject matter experts from other agencies to assist us, and also some subject matter experts from some industry lines of business that will help to bring information to the small business communities interested in doing business with HHS. Additionally, HHS does its e-matchmaking events where we bring together contract specialists, small business specialists, program managers to talk to our industry partners and those interested in doing business with HHS. We do that through our Access to Success web engagement platform, and you are able to locate the engagement platform through the Access to Success website, which you will see there. Very, very important tool. We are about to launch an electronic tool now to do e-matchmaking events, which will allow us to do them more frequently, because the laborious efforts of manually putting together matchmaking events will be a thing of the past. And so we're looking forward to launching that electronically and conducting more matchmaking events. I highly encourage you to take a look at that website and continue to look at it to see when our events will begin, and so that you're able to get involved with those. We also have various industry days that we're planning. I just mentioned that we just did one a few weeks ago. Please keep on the lookout. When there are industry days, likely, even if they're at our respective agencies, they will be on the Access to Success website. That is our national outreach website. And finally, I mentioned earlier some of our initiatives on category management, on engaging to allow for better outcomes, and buying as one unit versus 11 contracting offices. Very, very important initiative for HHS to understand more about how we can streamline our acquisitions and buy as a unit. Right, if you can go on to the next slide. All right, now how do you engage with us? Well, one of the things that I would say is responses to our sources sought in RFIs. So I often get from industry, yeah, but we don't get any responses from the COs and CSs. Well, one of the reasons that you don't get a response is because typically contracting offices are so short-staffed, they're unable to do the both ends. They're unable to pull it out as well as let you know, hey, here's what we did with your response. But know that we are reviewing them. So we take these sources sought in RFIs very seriously. When we put out a sources sought in RFI, typically it's because we are unable to understand what the market will bear as far as capability for a specific need of the agency. And we need you to be able to provide that information so we can understand the direction and strategy that we need to put in place to be able to secure that particular mission need. For small businesses, I recognize that it may add a slight burden. However, this is the way we make determinations as to whether or not something needs to be a small business set aside. If we get small businesses that submit the information as well, those small businesses have the capabilities to do the work, then we're able to make determinations that this potentially is a small business set aside. But we look forward to having these specific information pieces and your responses to these sources sought in RFIs for us to make those critical decisions. Other ways to engage with us. industry days. Make sure you're attending our industry days. As I mentioned earlier, you look at our agencies and see where your business approach, your line of business, and the work that you do aligns best with the mission of an agency. And so in that instance, please make sure you keep up with their industry days. Likely, there will be opportunities to engage with the program officials, the contracting officials, so that you're able to get additional information about those requirements. Target program officials to discuss your capabilities. I recognize, as well as strategic meetings with targeted programs. I recognize that in the time and in the models that we're working in right now, and as a result of COVID, it is very hard to connect with our program and our contracting officials. I would tell you to be relentless, continue to be assertive, and can send notes. If you get a number, you want to make contact, but the engagement initiatives and events that we hold will give you an opportunity to do that. So you definitely want to make sure that we're doing it. And then we are going to possibly shift here in the next year to doing more in-person events. The other things I would tell you, for those that are in the scientific communities, there are conferences. So if you're in that line of business, you likely have colleagues that are interested in the topic areas, the scientific topic areas that are going on at their community conferences. That might be an area that you may want to tag along and understand and meet the various individuals who are leading these efforts at agencies. And then finally, subcontracting. Very, very key to breaking into opportunities into an agency. So especially if you have not yet gotten on a category management vehicle, who is priming on these mission contracts at HHS? Finding out who are our prime contracts. These things are published. And then looking at partnerships with these large vendors who may be doing work on large mission contracts. Great way to demonstrate your capabilities, become knowledgeable of the program officials, being able to show what the work that your company is capable of doing, and let your work be seen and known. Very, very important. Subcontracting is definitely a way to get into an agency and ensure that you are able to become knowledgeable about the context of the mission and the things that they do. All right, we can go on to the next slide. So today I've talked to you a little bit about our mission, our spend breakdowns, our challenges, some of the initiatives that we have going on across the enterprise, few upcoming requirements, but I want you to take a look at SBCX and see more than that. I believe as we move more into ensuring that we are placing our contract opportunities in SBCX, I think that you'll be able to get more insight into the requirements for HHS. And please do not forget about taking a look at category management. It's here to stay. Our pivot to utilizing government-wide contracts to satisfy requirements will likely be our initial strategies if there's a contract available for the requirement that we have. Our industry initiatives and engagement, please keep an eye out for those and participate in those. And again, please make sure that you are taking a look at those RFIs and sources sought, because that will give you some insight also and advance notice of requirements that are coming out. So that's all I have. Thank you so much for your time today. I appreciate talking with you all about HHS. Again, it is such a vast mission, definitely an honorable mission to support. And I stand ready for any questions that you might have.
Thank you so much, Ms. Brisbane. I'm going to call on Becky again. Becky, if you can come on, and I know the audience has a few questions and we had some early submissions. So I will ask you to please moderate the questions for the audience. We are not going to unmute your lines. You must submit your questions in the Q&A box. Becky, are you with us?
Yes, excellent. Yep, we've got a couple of questions that did come through during the presentation, as well as a few that came in during the registration time. So we'll try to get through a couple that are general as well as more specific. So one of the first ones that came in, there was a slide presented on the spends and the different service areas. I was wondering if you could just provide a few examples of what falls under the professional services.
So it is very, very vast. First thing I would say is that each one of these are taxonomy areas that the federal government uses widely. So they're not just unique to HHS. And so one can go on to the GSA.gov website and be able to look at professional services and understand what actually falls into that category. For HHS specifically, some of the larger professional services that you'll find would be financial services, our programs management support services. We'll have contract support services, data analytical type of services that are also done. There likely are some medical support kind of services, those that aren't your hard and fast scientific, but support. There are laboratory support kind of services also that may not fall into the medical category. So it varies, but it likely touches many lines of business that the audience is interested in.
Great. Regarding some of the initiatives that you mentioned, there was a question if there are any current initiatives for mental health services.
So I would say that is something I can't answer. So there are in a $40 billion portfolio. I can't even begin to tell you how many actions there are across the 11 contracting offices. I would, if one would probably want to target the HHS agencies like the Administration for Children and Families, like the SAMHSA or AHRQ agency, to check out what it is that they are putting out with regards to requirements. But I can imagine that likely there are, and if they're not in this last fiscal part of the fiscal year, that there is likely going to be some in the next fiscal year. But there does range a myriad of services with regards to the health and well-being of the American public, and it covers the entire gamut. So those are where looking at forecasts are very, very important. And also attending some of the OSDBU events, because they do bring those particular pieces of information and program officials. And it's very difficult to bring everyone, to be honest with you, just because the vast amount of services that are offered across HHS. So what I would say to that is our SAM.gov, where we're putting procurement opportunities there. That is typically for proposals, so requests for proposals, but we're working on ensuring that those things are advertised in SBCX. As I mentioned, it's a new initiative and it may take some time to get everybody on board to be able to publish those in advance. But I would stay focused on SAM.gov, where contract opportunities are posted, or on GWAX for those of you that may have a government-wide vehicle.
Hey, Becky, this is Rena. I'm going to jump in just a second.
Go ahead.
Ms. Britton. You mentioned looking at forecasts, which is a great place to kind of get an overview of what the agency plans to acquire. But how often does your agency update the forecast? Because what we find is that the planned acquisitions don't really come out when they're planned at all, or most of the time they don't even show up as an RFP. So how often are these forecasts updated throughout the year?
All right, so as I mentioned earlier, this is a new initiative. We've had the forecast system, but just recently it has been made the formal forecast system for HHS. And there's a requirement, a memo put out by our deputy secretary to all the HHS agencies, that their forecast is to be input into the SBCX by a specific time, and then a refresh every March. But as I said before, it is a large agency, a large department. And so just like anything of its volume, it may move much like a cruise ship, right? And so it is a new initiative, and we have been pushing this initiative for some time. Finally got the support of the heads of the agency. And so we anticipate that we will likely, see a turn, but it may be slow, which is one of the reasons why we're pushing to have more industry days, which will be able to assist and help bring those contract opportunities to the forefront more quickly than we're able to populate. But again, also as a part of that initiative, each HHS agency is to appoint an individual responsible for inputting the agency's requirements. So this will be something that I for lack of a better term, that will be policed over time. And there is a point of contact that is going to be responsible for ensuring that that happens.
Thank you. Becky, over to you.
Yeah, and I know we're running short on time, so I might jump to one general question: is if somebody wanted to start with getting more information, where is the first place that you would point them to where they could start with the tip of the iceberg? Would that be the SBCX, the Small Business Customer Experience site, or where would be the first spot?
I would point them to SBCX. I would send them to the SBCX because there's a wealth of information in SBCX. Additionally, because that is also where you can connect with a small business specialist and be able to communicate on your capabilities. That small business, there's at least one small business specialist also assigned to every HHS agency who has insight. And one of the roles that they play is to ensure that when there are opportunities, that they are also bringing to bear those small businesses that they have been engaging with that brings capabilities that are needed by that agency. And that is indeed an active activity among our small business specialists.
Excellent. Marina, I'll turn it back over to you. I know we're right at the hour, so I'll let you give us a time scale here.
Well, thank you. I'd want to let Ms. Brisbane go, but I have one last question before I let you go. And
Okay.
that is from an industry perspective, where has the industry failed in meeting your expectations? What can the industry do better?
Well, here's what I would say. We are so happy to work with our industry partners in helping us to execute the mission. In a couple instances, in multiple instances, would find that industry partners sometimes take on opportunities that they may not be able to perform well. That is very, very important. It's very important, especially for small businesses and those that have just moved out of that small business category, simply because it makes the difference as to, one, your CPARS. Your CPARS rating is very important for your future business opportunities. And secondly, if in fact a business, a small business, or as we term it mid-tier, which is not a category. I want to make that clear. It's not a category. If you are unable to perform well when it's time for recompeting, one of the areas that we would consider is whether or not a small business or a company that is just slightly out of being a small business, whether they can really perform it, and we may not take that risk again. So performance is key. And it is king as to whether or not what we've done in the past continues to inform our strategies in the future.
Very good. Thank you so much. And I know there are a few other questions from the audience, which we will take on and answer them separately and directly. And if we need your help, we'll reach out to your office. But Ms. Brisbane, thank you. This was very informative. And what you said earlier, persistence, don't give up calling, emailing your team, because we cannot walk those halls. Not everybody has access to the agency. Not everybody is back to work in the offices either, but Yes, thank you. Again, we appreciate your time. Becky, thank you so much for being an awesome moderator, and we hope to have you again in the future. On behalf of the Asian American Chamber of Commerce, thank you all for attending.
Thank you.
Bye-bye.
Bye-bye.